Our Health Minister, Dr. Joe Phaahla, says about 100,000 doses of Pfizer's COVID-19 vaccine are at risk of being destroyed by the end of this month. It's due to the slow uptake by citizens, despite ample inoculations available. We're joined by the National Institute of Communicable Diseases Executive Director, Professor Adrian Puren, and the Progressive Health Forum convener, Dr. Aslam Dasoo. Good evening to both of you, and thank you for your time tonight. Dr. Puren, let me begin with you. You know, no amount of warnings over the past month about the expiry of these vials of Pfizer vaccine seem to have increased enough interest in it for them to not go to waste at the end of March.
Yes, that would be really unfortunate, I think. I'm hoping that the National Department has various initiatives, and I'm sure working with civil society and various other communities and organizations to really try and ensure that we get the maximal vaccine coverage that really is critical and very important. So I'm hoping again that whatever initiatives there are, that those are either expanded or rethought in order to ensure that we do not waste vaccines. There are ample opportunities. I think the fully vaccinated, stands at about just over 40%. So it's really critical to focus, as we have often said, on those that are vulnerable in terms of the age groups and those that have comorbidities, but perhaps also to look at the younger age groups as well as opportunities to try and expand vaccine coverage.
Dr. Dasoo, when it comes to why South Africans are choosing to not get vaccinated, do you think enough work, enough research has been done to try and uncover that or understand that and respond to those issues?
Good evening, Kathy, and good evening to Professor Puren and your viewers. Look, I think this is a complex situation. There are plenty of reasons why people are not taking up vaccination as we would like them to. And these reasons have been there for a long while, certainly since we began with vaccination last year. There has been research done by various bodies, from the HSRC to universities, even the Department of Health itself, the NICD, and the Vaccine Ministerial Advisory Committee. There is one common theme, though, and it relates to how vaccination and its need is communicated. It has been a rather corporate approach. We put it on TV and we have lots of graphs and we talk to people. There have been initiatives to use the media, for example, to get people to vaccinate. However, in many communities in the country, and particularly in rural areas, information of that nature doesn't necessarily seep into communities. You need local trusted leadership to be able to carry the message forward. I don't think there's been enough of the enlistment of this kind of local trusted leadership. Your traditional healers, your local nurses, your local teachers, people who could have been enlisted to communicate to their communities in an idiom to which they're accustomed. And I think that may have made a major difference. I also think there's been, of course, lots of misinformation around vaccination. And of course, there's also the question of access. Misinformation, and you and other media have covered this issue quite extensively regarding anti-vax kind of messaging on social media. And of course, I think in the end, access to vaccination, as much as we have, and the government has, and the private sector has created numerous sites, it's still difficult for many people to reach those sites. There's a cost involved, and we found, and research has shown, that has been a barrier. So a number of reasons, and it's an unsatisfactory situation. We should have had a much higher rate of vaccination by now.
Professor Puren, all of this is taking place at a time where many South Africans, of course, want to see a complete end to the national state of disaster. So literally no restrictions, and also the lifting of the wearing of the mask. What are the risks that you think would be associated with such a move where we have, again, not been able to reach even 50% vaccination of the adult population?
Yes, I would say that we should really be cautious. I know that this particular wave that we are in currently, certainly we saw what is called an uncoupling of the numbers of cases versus particular outcomes with regard to hospitalizations and death. And so I think we must not be complacent, because when you look at the previous waves, that was the Beta and Delta waves, for example, where we had certainly large numbers of cases, but I think really poor outcomes with regard to excess mortality and high rates of hospitalizations and so forth. So I think for us to argue that we should remove masks as a blanket statement, I think is really not really the way to go. I think we really need to be cautious. We've not reached a so-called endemic state, for example. We do not know how this particular virus will evolve, what the next variant will look like. So I think we really need to look at a risk-based approach, which is what has been adopted by the government currently, and to say, well, what is it that we can certainly do to protect individuals at the different levels, and that includes the wearing of masks. I think we really need to be cautious about saying, just simply remove masks. I think we really need to look at the different settings where masks will still be appropriate in combination with, for example, other interventions such as ensuring ventilation, ensuring the numbers are well managed. And again, coming back to ventilation, that's also really critical consideration. I think some of us don't really understand the complexities around, for example, ventilation in offices, in workplaces, in restaurants, and so forth. So I think those are the particular factors. I think it's not a matter of simply removing or uplifting the Disaster Management Act, but also to look at what are the risks that we are going to be faced with, and how to manage those particular risks.
Dr. Dasoo, again, when we take just more broadly where the South African population seems to be, there seems to be a general fatigue when it comes to implementing some of the protocols around COVID-19. What does this mean for a potential fifth wave that we could be facing in a couple of months' time?
Yes, I think this question of fatigue is very real. Yesterday was the anniversary of the first positive patient in South Africa 2 years ago. And I think 2 years of having gone through lockdowns, restrictions, severe waves of infection, lots of illness, lots of death, has an impact, on people. And it's not surprising that they feel like they're done with it and they want to move on. But I agree with Professor Puren. I don't think a blanket removal of all restrictions. I first of all think that the state of disaster under the Disaster Management Act can be done away with. There's sufficient powers that the government has, executive and legislative, that exist to manage any contingencies arising in future from any new variants and new waves. There will be a fifth wave, of course. I also agree that masks have proved to be useful in preventing transmission, in particular in areas where there's a higher risk of it, in congested indoor facilities, poorly ventilated areas. And masks, however, in the open space that are poorly fitted and inappropriate don't really help. So, having all of that in mind, one should encourage as much as possible that people take, prudent measures to manage this process. One hopes that 2022 is the year we pivot out of the emergency phase of this pandemic into a recovery phase that we still, is yet to be seen. But after, being hit by once in a 100-year pandemic of this nature, which has completely, disrupted society around the world, we have to take cognizance of what we have learnt in that process. And if I may just say that, look, I think a lot of lessons that we have all learned over the last 2 years are not uniform, unfortunately. Those of us who are knowledgeable about the pandemic may have gotten deeper insights, but society as a whole wants to move now away from the emergency restrictions, the lockdowns, the constant barrage of bad news One understands that. But we are still in the...
Dr. Aslam Dasoo, Professor Adrian Puren, let's leave it there for tonight. Thanks for your time.